You can buy Motilium online at lowest prices. Worldwide shipping. Click on link in description. Indications. Motilium is indicated for an NBSP, 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 delayed gastric emptying of functional origin with gastroesophageal reflux and/or dyspepsia, an NBSP, 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 control of nausea and vomiting of central or local origin, an NBSP, 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 as an antiemetic in patients receiving cytostatic and radiation therapy, an NBSP, 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 facilitates radiological examination of the upper gastrointestinal tract. An NBSP, instructions and NBSP, use Motilium as directed by your doctor. Take Motilium by mouth before meals. If you miss a dose of Motilium, take it as soon as possible. If it is almost time for your next dose, skip the missed dose and go back to your regular dosing schedule. Do not take 2 doses at once. Dosage acute conditions mainly nausea, vomiting, hiccup, adults, 2 tablets 20 mg 3 to 4 times per day, 15 to 30 minutes before meals and, if necessary, before retiring. Children 5 to 12 and NBSP, years old, 1 tablet 10 and NBSP, mg 3 to 4 times per day, 15 to 30 and NBSP, minutes before meals and, if necessary, before retiring. Chronic conditions mainly dyspepsia adults, 1 tablet 10 mg taken 3 times per day, 15 to 30 minutes before meals and, if necessary, before retiring. The dosage may be doubled. An NBSP, children 5 to 12 years, and FRAC 12 tablet 5 mg 3 to 4 times per day, 15 to 30 minutes before meals and, if necessary, before retiring. This formulation is not suited for children under the age of 5 years, but for this group of patients the suspension is available. Motilium tablets are not suitable for children weighing less than 35 kilograms. Motilium should be used with caution in patients with renal impairment or in those at risk of fluid retention. In patients with severe renal insufficiency, serum creatinine more than 6 mg, 100 ml, i.e. more than 0.6 mmol/L, the elimination half-life of Domperidone was increased from 7.4 to 28 hours. The dosing frequency should be reduced to once or twice daily, depending on the severity of impairment, and the dose may need to be reduced. Patients on prolonged therapy should be reviewed regularly. Ask your healthcare provider any questions you may have about how to use Motilium. Storage. Store Motilium between 68 and 77 degrees Fahrenheit 20 and 25 degrees Celsius. Protect from heat, light, and moisture. Do not store in the bathroom. Keep Motilium out of the reach of children and away from pets. More info, active ingredient, Domperidone. Motilium tablets contain lactose and may be unsuitable for people with lactose intolerance, glucose, galactose malabsorption or a genetic disorder leading to accumulation of galactose in the blood, galactosemia. Medicines and their possible side effects can affect individual people in different ways. The following are some of the side effects that are known to be associated with this medicine. Just because a side effect is stated here does not mean that all people using this medicine will experience that or any side effect. Rare, effect between 1 in 1,000 and 1 in 10,000 people, increased level of prolactin, milk-producing hormone, in the blood, hyperprolactinemia. Sometimes this can lead to symptoms such as abnormal enlargement of breasts in men, gynecomastia, abnormal production of breast milk in men and women, or stopping of menstrual periods in women. Decreased sex drive in men. Very rare, affect less than 1 in 10,000 people, stomach cramps. Diarrhea. Itchy nettle-type rash, urticaria. Abnormal or uncontrolled movements of the hands, legs, face, eyes, neck or tongue, for example tremor, twitching or stiffness, extrapyramidal effects. Consult a doctor straight away if you notice any symptoms like this. Allergic reaction. This is not a complete list of all side effects that may occur. If you have questions about side effects, contact your health care provider.